Okay, I hope everyone can see me. Welcome everyone. Gareth Presh, founder of the World Health Innovation Summit. Absolutely delighted to welcome you to our session today on the impact of COVID-19, public health control on SDG implementation process. I'm going to be joined with colleagues from around the world, where some of our speakers are joining us from Australia, from the UK, from Africa. We've had a few of our speakers have had to drop out due to work commitments today. But we're very much looking forward to hosting you. And if you have any questions throughout the sessions, please do raise your hand and we'll take those questions once the speaker is finished. We want to give an insight into the opportunities that COVID-19 has also created in terms of looking at the future of healthcare. I'm going to start by just inviting Dr. Nasibu Mwande to give us an introduction, and then move to James Sanderson from NHS England and the CEO of the National Academy of Social Prescribing to do a short introduction. And then we'll get into some presentations around the Global Social Prescribing Alliance, and also from TUAIDA, which is the Tanzanian diaspora, on how they're supporting Africa during COVID-19. We'll take around the questions about the SDG implementation, which is good health and well-being. But let's start and meet some of the panelists. Dr. Nasibu Mwande, you're very welcome to the session, and delighted you can join us today.
All right, thank you very much, Gareth. And I'm so delighted to be here with everyone, actually. Okay, like Gareth said, my name is Nasibu Mwande. I'm originally from Tanzania, and I'm an emergency medicine physician with the North Cumbria Integrated Care NHS Trust. And at the same time, I'm the vice chairman of the Tanzania UK Healthcare Diaspora Association, which basically is all the people from Tanzania who are interested in healthcare matters. You don't have to be a doctor or a nurse, but as long as you're interested in healthcare, and the well-being for that matter, and you are happy to join. And you can be from Tanzania or not, but we are a very good organization. We're quite young, and we are learning on the go as well. And we still have done quite a lot of things so far. So that's me briefly. Thank you, Gareth.
Thanks, Dr. Mwande. And we'll get into the role of TUAIDA and the work that you do to support Africa very shortly. Delighted to welcome the CEO of the National Academy of Social Prescribing, my colleague who works with us on the Global Social Prescribing Alliance, James Sanderson. James, an introduction to everyone who's joining us.
Thank you very much, Gareth. I'm really delighted to be here this afternoon, and great to get into the opportunity of discussing some new innovations in healthcare and how we meet the challenges of the Sustainable Development Goals that we all want to achieve. So I'm James Sanderson. As Gareth said, I'm the new CEO of the National Academy for Social Prescribing, which has recently been set up by the UK government. And I'm also Director of Personalised Care for the NHS in England, and also Director of Palliative and End-of-Life Care. So I'm looking forward to talking to you all a bit more about social prescribing very soon.
Thanks, James. And as I said, if anyone has any questions while we go through the sessions, please do pop your hand up and we'll take those questions through Q&A. Let us go back to Dr. Mwande and start with his presentation around the work of TUAIDA. Naz, over to you. And we're looking forward to hearing how we can support Africa and the wider community through good health and well-being, SDG 3.
Okay, thank you very much, Gareth. Let's get to TUAIDA, like I said, for the Tanzania UK Healthcare Diaspora Association. Our main objective is mainly to have the best of both worlds, because we are from Tanzania, and most of us, we work in the United Kingdom. Now, the main aim for when we're in the UK, we have more advantage than our colleagues back in Tanzania. So what we're trying to do is to share those experiences, because to have a two-way learning and encounter. So we support our colleagues in Tanzania in skills and knowledge building, and that is the main objective to start with. And along with that, we just help working together with the government to find ways of helping them to build capacity. Because I think we work there, most of us who work in Tanzania, we know where the challenges are. And work in the UK, we can see how things are done in here. So, and we can translate those into our community in Tanzania in a way. I know those are two different environments, but I think try to build on the strength of the people on the ground in Tanzania and so make some small adjustment according to their capability. It would be a better way than us imposing something that, okay, this from the UK, have it in Tanzania. It won't work like that. So we try to create a level playing field where we can all find solutions to our problems in a very fair and equal manner. At the same time, as well, with a bit of technology, we try to, if we can source some, because the things like diagnostic and the equipment and the working tools for healthcare, and what we're trying to do, because here sometimes with change of technology, stuff get chucked away, for example. I mean, be thrown away while they're still actually working. And why someone in the rural Tanzania, for example, they don't have this equipment. So we try to find something that is useful. I mean, it may be old, but still useful, and it can help to save lives. So we try to find this kind of equipment solid for our colleagues on the ground as well. But one of our main projects that we have done, because we are main on skills building, we have established a medical simulation center at Tumbi Hospital in Tanzania, where we can train people, or people can train and learn on a high fidelity mannequin instead of learning on human being, which is where the traditional way. So you can go to the simulation room, train your people and learn, make as many mistakes as possible. And then when you go to see the actual patient, you can, you have refined your art. And that's the main thing, which we have achieved. And we have another project with the same simulation center with to Zanzibar as well. And because of COVID, we have not managed to take that off the ground. But we still have the kit. We just have to find the funding to transfer the kit to set up in Zanzibar. And so during the time of COVID, because we don't have much face-to-face, we made good use of the technology. So we have done quite a lot of webinars for the community and for our healthcare colleagues as well, to share experiences, see what we're doing here and what they're doing there. So we just, and we find that what they did there, some of the stuff we tried here, maybe be at a community or individual level, and sometimes when in our work environment. So that collaboration is very, very important, and that's what Tuhera is built on, that collaboration and partnership, because we believe that is the future of healthcare and the well-being. So in short, that's what I can say of Tuhera in brief. But if anyone got any question, they can just, I'm here. Yes, sir. Thank you, guys.
Thanks, Dr. Miranda. It will be great to get some questions. And also, could you give us a bit of an insight into what it's like on the ground at the moment in Tanzania in terms of the impact of COVID-19? I mean, worldwide, we've seen, we're almost at 4 million deaths. We've seen, I think we've nearly close to 3 billion vaccines distributed. And it would be just great to get an insight from your perspective, how you're supporting local communities in Tanzania. I mean, because misinformation, the dissemination of information is so critical. We hope Manuela Boyle can join us shortly so we can go into health literacy. But please tell us, if you can, how are you supporting locally in Tanzania at the moment during this crisis time?
Okay, thank you, guys. Okay. What we have done for last year, we have to advise our colleagues and the community on what is the best practice for the situation that we are in. So we supplied some like PPE and masks to different hospitals, and because like before then, people wanted some surgical masks, and that time it was a very rare commodity. So people, they couldn't get it. So we started to advise people to make those masks at home and the large scale to give to people who they cannot afford. This is something very cheap that, and you don't have to worry about disposing, because when you have disposable masks for Africa, it's quite a big problem, because people may end up reusing those things, and they are not very hygienic. So if you have a cotton mask for them, then we might to sort a lot of them. We funded some, so people use them, and they help quite a lot. And again, the main thing for now, people with information to help them become a very good source of information. We gave a lot of webinars on vaccination and how COVID as well was spreading and what people should do. And they warned the people with the danger of misinformation, just going on the internet, finding something that they think is correct. There's a lot of conspiracy theories out there. So we conducted some webinars to highlight or to give the people the right information. The most important thing, in a language that they can understand. We have to give a webinar in Swahili, most of them, because most of people speak Swahili. So again, normally is bilingual, because sometimes we don't have the words in Swahili for certain English words, so we just mix up. But the key was to give the people information, the right information in a language that they can read, understand. And so we're still working on that. And because we talk about the mental health as well during the COVID time, because the impact of mental health cannot be underestimated. It happened here, and it's worldwide. So we get a lot of webinars on mental health and well-being, how people should look after themselves, and what signs to look out for when someone is having some mental problems. So this is the kind of information probably someone in the remote areas will not understand, or because we don't have many mental health staff in Tanzania, to be honest. So having this kind of conversation and the webinar, we can have in a small chunks as a link on YouTube. You can share with people on their WhatsApp. They can watch them when they are somewhere the signal and get that information going. So that's what we have done. But at the moment, data was a problem for Tanzania during the COVID period. Probably we all know about that. But at the moment, things are a bit different. Even the president mentioned a couple of days ago that okay, people have to take precaution. They have to wear a mask in going to public buildings, and as well, she mentioned that there are about 100 cases of COVID in the country, and I don't remember how many of those are there on ventilator, but at least people, we can talk about it. So when you talk about something, you can easily engage with people. You don't have to be scared to mention if you're breathing problems, why you mean it is COVID. So we are heading the right way, I think, but the Tanzania, again, joined the COVAX thing, so which is a good thing.
Fantastic. And there's over 40 countries in Africa have joined COVAX. James, we want to look at solutions, and I think one of the key solutions and opportunities for Africa is to adopt the social prescribing model, which you've been pioneering in the UK and working very closely with colleagues around the world through the Global Social Prescribing Alliance. Can you, over to you for your presentation? Really looking forward to putting some solutions on the table.
Thank you very much, Gareth, and thank you, Mwandi, Dr. Mwandi. It was great to hear your presentation and some of the challenges that you're involved in. I think, firstly, obviously, modern medicine is amazing, and we, in many ways, it's one of humankind's greatest achievements, the development of modern medicine in the 19th and 20th century. The discovery of antibiotics, the onset of vaccination, and modern medical procedures that save millions of lives. And we're seeing the significant benefits of the rollout, obviously, at the moment, of a vaccination for COVID-19. And there's lots of global challenges on ensuring that vaccination reaches every part of the world. But actually, modern medicine also has its limitations. And what we're seeing in a number of health economies across the world is that medicine sometimes can create greater harms. We're seeing issues of antimicrobial resistance. We're also seeing issues of addiction to opiates. And guidance is beginning to change in many countries around the prescription of opiates for chronic pain, and lots of guidance around the benefits of exercise coming in. So whilst we have this fantastic opportunity to use medicine to create health and well-being for people, we also recognize that the majority of health isn't what is created in hospitals or in GP practices. And actually, when we look at the sort of issues that society is facing, and when we're starting to try and build sustainable solutions for healthcare, we realize that some of the social reasons why people actually don't achieve good health and well-being outcomes can be down to issues such as debt or loneliness or housing or food poverty or effective sanitation. And actually, we need different ways of solving this. So what we've been championing over the last few years in England is an approach called social prescribing, which is part of a movement to rethink the medical model and look at better ways to engage people within with their health and well-being. So it starts on the basis of asking people what matters to them. It starts on the basis of finding out about the challenges and the issues that they're facing as an individual, and breaks down the silos that we sometimes have in healthcare systems, because sometimes we can assume that an individual has cancer on a Tuesday and mental health issues on a Thursday, not seeing that whole individual on a single day with everything that's impacting on their lives. We also fail sometimes to treat the underlying causes. So somebody may be presenting with respiratory illnesses, for example, but actually, if that's caused by living in conditions that are significantly affecting that respiratory illness, whether that's damp conditions, for example, then actually treating that condition is not likely to resolve the issue for that individual, and we need to look beyond that. So this is where personalised care comes in, starting with the individual, developing a plan that holistically looks at their needs, and then starting to find solutions that perhaps demedicalize the way in which we can support them, rather than reaching all the time for drugs, which, as I say, still play a part, but sometimes a social solution could be better. And social prescribing works on the basis of trying to find connections for people, trying to connect them to something in their communities, connect them with things that are meaningful for them, activities that may support their wider health and well-being. And it works across 4 key zones. So the first being arts and culture activities. We're seeing a lot of benefits in music, for example, in dance, supporting people living with dementia by developing community choirs, by developing falls prevention in care homes, by sending professional dancers to get people active, get people moving, and strengthen the opportunity for people not to fall over as often. Opportunities of using the arts in a creative way. And actually, the English National Opera have developed a groundbreaking programme to support people who have had COVID. And they're using opera singers to train people in breathing techniques to improve lung capacity and improve their breathing as a consequence of the damage that's potentially been caused by COVID-19. The second area is physical exercise, getting people connected to walking groups, to doing park run, to opportunities to get out and about and remain active. Now, that can be really, really simple. It could just be walking a few yards and building up from there. It doesn't have to make everybody into somebody that can run a marathon. This is about, again, working with that individual, finding out what sort of movement, what sort of exercise is going to be good for them. We also know, the third zone, that nature is good for us, being out in the natural environment. There's lots of studies that have proven how beneficial nature is for people's health, and actually encouraging people to connect with nature, connect with groups that are involved in gardening groups, in conservation is really key. And finally, the fourth area is about knowledge and wisdom and learning. We know that 40% of people living with long-term conditions lack the skills, knowledge, and confidence to look after themselves, and they lack the information that they need to live their life in the way in which they would want it. We also know that even when provided with information, a lot of people don't understand the health information that they're provided. So how can we educate people? How can we give them the opportunity to become experts in their care? And the evidence for this is also really strong. If you move somebody from having very low skills and knowledge to having the highest possible knowledge about their condition, you can reduce the visits that they make to a GP by about 19%, and you can reduce hospital admissions by about 38%. So just by increasing that ability for people to have that knowledge. So social prescribing is creating a new revolution in the way in which we focus on healthcare. And we've worked as the National Academy for Social Prescribing alongside the World Health Innovation Summit with Gareth, and also the United Nations Global Sustainability Index Institute and the WHO, the World Health Organization, in order to form a global social prescribing alliance. And the aim of the Global Social Prescribing Alliance is to advance social prescribing and create thriving communities across the world to generate this revolution in well-being. We want to help people to develop a narrative for the way in which health and well-being can be achieved. We want to connect clinical leaders across the world, and we've begun by having meetings in various countries, bringing clinical leaders together that are championing this movement. We want to develop innovative community approaches, working with organizations on the ground across the world, the fantastic organizations in the voluntary sector, in the social enterprise sector, in faith communities, right across the world that do amazing work. How can we connect those together? How can we connect the groups that are working in the natural environment with those that are working in the arts, with those that are working in sports and activity, to create a strong community based around common goals? How can we train the workforce? How can we get people to focus on delivering healthcare solutions in this new way? And finally, how can we develop digital solutions as well to get people connected? So the Global Social Prescribing Alliance is there as a support for countries around the world. We're looking forward to working with key partners over the next few months. And today's a great opportunity to share the work that we've been doing. Thank you. Back to you, Gareth.
Thanks, James. And I suppose from an African perspective, it brings opportunity, given the, shall we say, if we look at the current system, which is based on, disease, which is a pathogenic approach, and very much looking at the well-being and SDG 3, social prescribing very much aligns to that in a way that you can actually create new and meaningful jobs through the arts, as you've highlighted. And that brings me very much on very nicely into our next speaker, which is Ingolf Erdner, who's going to give us an insight into, and this is what I hope this session will generate, is solutions. And as James has mentioned, the importance of the arts. And Ingolf is a world-renowned pianist who works with us on SDG 3 and 4, quality education. And we felt that this would be a fantastic opportunity to show how the arts can influence positive change and SDGs for the future. Particularly Africa has a huge opportunity, I think, in the future to invest wisely, as James mentioned there, the knowledge that we have and Dr. Miranda has spoken about. Ingolf, an introduction, please, and then by all means, the floor is yours. Please do share your wisdom and how the arts and creative arts can support the bounce back from COVID-19.
Thank you so much. It's a pleasure being here. First short introduction. I mean, as you said, I'm a pianist. I'm a conductor and composer, and I've performed in over 50 countries by now. And our mission in education started about Well, we had the first observations 9 years ago on the plane to Japan, because we have seen all these countries and we have seen the problems that are everywhere basically the same. So either music education is cut out of the curriculum completely in all the countries, or if it exists, it's nowhere near good enough to really bring substantial value to people, both to professional musicians and to amateurs. And I will come to why that's important and relevant, because if you zoom into the body and go on the quantum level, we are all frequency. Everything, each cell and everything that we do is frequency, and that's why music is very much a part of everybody, even though people don't really notice that they are exposed to music, because the problem with and why music is important to us is that it, if you look at something, if you have visual input, or if you eat something, chemical input, then it's your decision whether you look at the thing or whether you eat that thing. But the ears you can't close. So no matter what you do, you are constantly bombarded by audio input your whole life. If you go through a busy city, it's very, very much visible that it's absolutely destructive, actually, all this noise. And as it can be destructive, it can be also very, very beneficial if you are exposed to quality and valuable music. Even though if you don't understand it, the body will still understand it, because this is the same thing as I always tell to people in my master classes, that every human is musical. We just lose it over time because we don't cultivate it. But even though we lost the musicality, so to speak, the body still needs the waves and the music on a high level. And I also say that when I'm lecturing to fellow musicians and pianists, that it's so important. It's so important what you give your body. You would also not eat McDonald's every day for 10 years, and still. So since we don't do that, we still do that with music very much on an everyday basis. We give ourselves fast food, and which is very, very unhealthy. And for sick people anyway, I mean, as James said, it's absolutely proven how beneficial music and the arts can be for the healthcare. But even for healthy people, it's so important. And this is our big mission. And now I've messed everything up probably, because I should also say what we do. Actually, this mission of ours led Paulina Wunder, my co-founder, and me to start 2 startups by now, Appasio and Appassimo, which are software solutions for music education. We are blessed to have many clients, high-level universities all over Europe that use our software on a daily basis for their music education. And we have the technological expertise to bring much more than what we currently do. So our plans are very much going into medical fields where we will use our algorithms to match people both musically and especially emotionally with how what's your energy and how you fit and who can be the right educator for you, because the right teacher for me is not necessarily the right teacher for you. And this is our motto. So what we want to do with our software solutions is to give people the connections to people that can actually help them and actually give them the wisdom they need in order to thrive. So yeah, so I think very much this is very, very important for our society too. And it's overlooked until now, one has to say. It's not mainstream, but I'm very happy that it comes very much into the minds of people. I will speak about that amongst other conferences at the Internet Governance Forum in December this year, which shows that it's politicians and change makers are absolutely interested in the angle of music, especially in the hyper technological future that we go into. This is the last point that I want to make, that in the future where most likely whatever will come, if it's singularity or if it's AGI or just a very sophisticated version of AI that will basically shape our lives in a substantial way, it's very, very important that we actually give the people, the humans, the skills that to be better than the super machine of the future or of the past or of the present already, because the computers are very, very good in dealing with loads of data, much better than we will ever be. But there is soft skills, there is 21st century skills, and all these human abilities that will be twice as important in the hyper-technological future. And music is absolutely the way to get all these traits and skills that you will need in the job market of the 21st century. And that's why I think it's very, very important that we include the arts. And I'm very, very happy that with Gareth's and Roland's and you and GSII work, we have together created already the SDG Youth Symphony Orchestra that will be hopefully growing. And that shows especially how thirsty youth is for music and actually how bright the future can look. So I'm very, very happy.
Thanks, Ingolf. Fantastic to get an insight into the opportunities going forward from the music perspective. I think you made a very relevant point that we don't really think about music as in frequency, as in what goes into our ears. We can't close our ears. I think this is an important part of health and well-being, because what we think and what we absorb, we very much become. So it can have a detrimental effect on our health and well-being. And I suppose if you look at over the last 18 months, we faced enormous challenges, a lot of negativity. James mentioned mental health and well-being, so huge challenges there. What I'm going to do now is I'm going to give a short presentation on Sustainable Development Goals, the work that we're engaged in around SDG 3 and supporting SDG implementation around the world through World Health Innovation Summit with our partners, Global Social Prescribing Alliance, and also the work of the UN GSII Foundation working in the 25+5 cities, the UN Habitat partnership that we have around the cities investment platform as well, and then give an insight into what the future of healthcare looks like and the opportunities for Africa going forward. So I'll just begin to share my screen and then just dive into a presentation, a short presentation, which I hope you can all see. Just a little bit of an intro to myself. Who I am, what I do, shall we say. I'm the expert lead on SDG 3 with the UN GSII Foundation, member of Pope Francis's Vatican COVID-19 Commission, Group 2, which is looking to the future, working with James on the Global Social Prescribing Alliance, and there's our contact details. If I go to what is the real challenge of the future, shall we say, I think we're all well aware of what comes after COVID-19 with climate change, potential of a recession, biodiversity collapse. These are the sort of things that are on our agenda. And I suppose this links in very nicely to what Ingolf was speaking about, what is currently being fed to us, and it's extremely negative. Let's look and see what the future shall hold in terms of positivity, and look at the current situation with COVID-19 and how we can use platforms to create value, and also the opportunity of healthcare to become that catalyst of creating value. Business and COVID over the last 18 months, we've seen about 400 million jobs lost, but at the same time we've seen a lot of companies, the top 30 companies in the world, certainly have increased their profits up 100 million or 100 billion plus. And what sort of value are they reinvesting back into communities? So the Oxfam report recently, they're only reinvesting 0.5% of that profit back into the community. So we need to look at how do we fund companies in the future, and that's very much aligned to the SDGs. We want to see the future of business aligned to social value, and we believe through the World Health Innovation Summit, through our partners, that we can create new and meaningful jobs and wealth creation through platforms, as the tech companies have done in the past, similar models, but also amplify that through health and well-being. So just a little bit about WIS and what it does, how it works. It's a platform, it's a global platform. We have programs for children. WIS at Work looks at stress management in the workplace, seniors, falls prevention, quality of life and loneliness. And then Green is very much focused on environmental issues. We bring people together, we connect the dots, we basically break the silos, we bring patients, clinicians, managers, voluntary sector, education, and the business communities together to share that knowledge so that we come up with solutions, and then we amplify those solutions across the world to bring investment also. So this is very much what James was speaking about, and very much aligned to social prescribing as well, and the current model that we have. And really, if you look at the process of disease, you'll see the red section here. And this is very much what we have based our whole healthcare model on, which is treating disease. And really, this brings with it huge challenges, as we've seen. And by 2030, we'll face a staff shortfall of about 18 million staff worldwide. And I know in Africa, for example, there's chronic shortages of healthcare professionals, and across the UK and worldwide. This is a huge problem, and it will lead to further problems in the future, particularly with COVID's impact. In the past, UK, Europe, America and Australia would have been able to attract staff from the likes of the Philippines and other areas. And I can foresee that those countries who've suffered during COVID-19 will look to retain their own staff now. So you're going to see a big shift in how recruitment and retention of staff comes in the next few years. But the opportunity around social prescribing and looking at SDG 3, good health and well-being, is in the green here. And this is where we can actually create models and new ways of working that promotes good health and well-being. So prevention at scale, that's really where the opportunity lies. And I think we all believe that there's an opportunity here to create new and meaningful jobs, but also implement the 17 Sustainable Development Goals using these platforms that are now out there and amplifying that message. It's important that the investment flows into these areas so that we can move. At the moment, we only have about 4 to 6% of global investment. Around $8 trillion a year is spent in the healthcare system. You only have 4 to 6% of that actually goes in prevention. So it's time to, grow that sector, and let's see what the results bring. We believe if you put £1 in, you'll get 36 back minimum. So again, looking at why do we need to do this? As I mentioned, the staff shortfall, the health economy is growing, more money funding going into it. Global population, as we all are aware, we're getting close to 8 billion. This will grow nearly to 10 by 2050. The number of people over the age of 60 should reach roughly 2 billion very shortly. And COVID-19 has really shown how vulnerable our health systems are. So we're ill-equipped and we need major transformation. And that's why we need to accelerate the process. We need to get around the table with all the partners and ensure that we bring investment to the table as well to promote good health and well-being. Mentioned the Cities Investment Portal, which is a partnership between UN Habitat, Think City, UNGSII. And basically what we're doing is we are connecting investors with projects in developing nations and around the world. Klagenfurt has just joined as an example. And this is a portal that will allow us to invest in sustainable activities of the future and make that energy transition. Again, it's an SDG platform for fast tracking SDG implementation. There's more of this on our website, and I can share the details afterwards. Just a little bit around partnership work, and James mentioned the faiths. They play a huge role. Having a partnership with the Catholic Church, working with the Vatican COVID-19 Commission, the European Commission, Michael Muller there, the initiative he set up, the United Nations Global Sustainable Index. And that's the session there at the SDG Lab in Davos. So partnerships is all about ensuring that we get to where we need to be by 2030. You'll hear a lot of talk about net zero and 2050 and that, but let's remember that 193 heads of state agreed to implement the 17 SDGs by 2030, not 2050, not 2045, but 2030. So we need to accelerate our strategy, and we need to ensure that we reach those targets so that we leave no one behind. James mentioned the Global Social Prescribing Alliance, and this was an initiative that we've launched with WHO and National Academy of Social Prescribing and UNGSII. And this really is about us being able to export that wisdom. I mean, the UK is certainly leading in this space, but we now are developing partnerships right around the world. We have an upcoming meeting with the Californian Surgeon General, for example, reaching into the States, and also working with our partners in Africa and Asia and around the world. And we very much see this as an area of growth. So this is something that you can check out, globalsocialprescribingalliance.com, and you'll be able to find out more information. And we've also just published a playbook, which gives a fantastic insight into how you can implement these projects locally. Just going forward, then, what are the next steps in terms of G20 and supporting nations make this change? Myself, James, and colleagues from Finland and Roland spoke at the recent Global Solutions Summit, which is a think tank for G20 nations. And we very much see this as an opportunity for the future. We've had a briefing paper that we submitted, and that's being considered for the T20 and G20 event in later this year in October in Italy. So we'll have a further opportunity to lobby and bring about policy change. Finally, I just wanted to talk about, the SDGs, and it really does give us a roadmap to build back stronger. We can embrace the change. We can work collaboratively. We can be solution focused, but most importantly, we need strong leadership, and we need those and you watching this to take action, to see what you can do. Can you implement positive change locally? So that's really an insight from myself. I will just stop my sharing of the screen and just say that I hope that you find that interesting, and we'll go back to the panel now, and we'll just ask Dr. Miranda if you could give us an insight into what you see the challenges will be and opportunities over the next 12 to 24 months.
Hi, thank you, Gary. I think for the moment, the challenges, I try to look into the opportunities first. I think that's the key thing with every crisis comes an opportunity. I think we have seen in this pandemic, there are a lot of young people. I mean, because Africa is a very young continent, a lot of young people, and there are a lot of smart and creative minds. And most people can think out of the box most of the time. That's how life is in Africa. You have to think out of the box all the time. So during the pandemic, there have been a lot of innovation happen to tackle the pandemic, like things like homemade hand-free sanitizer to wash your hand and things like that. And people build some ventilators as well in Africa. But the problem is, I think we don't appreciate what we create and just develop that to go further. And so we just we become more consumer than just producers. So I think if we can stop and sit back and just look, we have something, we have a big opportunity here to make a big difference. By this crisis, we have creative minds that can think and bring out stuff that can help our community. The government and the leaders and the policymakers should support those young people who come with all this creative work. And I think most of the time, when the crisis is over, those people get forgotten and nothing happened, and you never hear about them ever again. And I think we have to take this opportunity so if Africa needs to move forward. The other thing as well is the diaspora. The diaspora, African diaspora, have a big place in making change in the continent. And I think because those people, they understand how things are and how things work in there. So I think it's easier if they feel more valued and supported, they become more willing to bring whatever expertise and the knowledge and skill that they have back into the continent and make the continent even much richer. Because personally, I believe the continent is not a poor continent. That's got so much resource that just unfortunately is the management of the resource is just done a little bit badly or in a selfish way. So I think that is a way that we can use in diaspora to make some positive gains. The other opportunity is for the tech companies in Africa as well, or in the world, who want to invest in technology. I think we have found that during this pandemic, the digital technology have just played a very big part. So, things like, now here we are talking somewhere in Kampala, somewhere in Australia, we're in the UK, we just having this conversation. This is and before then, probably this was not seen as a thing. So I think the tech companies, like the telecom companies, they should just build or beef up their network so that people in the remote areas of the continent can access, because there's a wealth of information out there, and there's a lot of things that they can gain from others. The learning opportunities, because so if they can make the networks more accessible and more powerful, if you like, we can have more reach, and we can just empower our people. Because like Ingo said about the music, okay, in Africa we dance. In Africa we play music. Everything, the funeral, the party, people dance and sing, and and that because. And I took my kid to Africa 3 years ago, and they were just like, wow, because even little kids are just dancing, and my kid couldn't stop that joining and enjoying that. And I think that's part of well-being. And in Africa, we don't see that as an opportunity. We see it like just a way of life. In a way, it's good, but I think we can capitalize on that. That's a big opportunity as well. And so if you can start a symphony in Africa, you can have fantastic tunes, which are just probably the creativeness is just endless. So there's another opportunity for, let's go to Africa and just create a symphony, and it just should be great. So that's it. Yes, Gavin.
No, I think that's a great insight. So I think you're definitely should we say, opening opportunities here in this discussion. And I'll just say to those who are listening in or viewing, if you do have a question that you want to put to the panel, please, by all means, raise your hand and pop in the question in the chat bar. I just want to, I'll come back to you, Naz, because I wanted to talk about the dysphoria, but also the youth. But let's go to James. And James, over the next 12 to 24 months, we're going to see, opportunities arise in terms of, out of the challenges that we face. We need to adopt new models of care. We need to look at new ways of working. You spoke about how the UK is working with English opera. Can you just expand a little bit on where you see the future in terms of healthcare, social prescribing? I know, you're UK focused, but also with the Global Social Prescribing Alliance, where the opportunities are. And then we'll come to Ingolf and talk about the music opportunities.
Thanks, Gareth. So one of the things that we're doing here in England, and a lot of countries are also looking at investing in this way, is the development of non-clinical workers in healthcare who can actually actively work on connecting people with the vibrant opportunities that there are in our communities. So in England, we're calling those individuals link workers. We now have 1,500 link workers in place. Got an aim to have 4,500 link workers in place. And what these individuals do, and fantastic work that goes on right across the country, is that link workers sit down, have time to talk, find out what matters to that individual, look at the barriers, the issues that they're facing, look at the challenges in their life, and then start to work with them to make connections to groups, to community interventions, to activities, to specialist services, to peers, perhaps living with the same condition as them, to volunteers in the community. And connecting people in this way creates the environment for health to be developed naturally, and creates the environment for those connections to forge lasting partnerships to sustain the health outcomes for that individual. And I think that's a really radical way of looking at healthcare, actually, starting with an individual. It may sound ridiculous, because we've known that individuals have skills and knowledge that they bring to their own healthcare for a long period of time, but actually we don't always value that. And working with those individuals to unlock the assets that they bring to their care is incredibly important. And I think as we look at your question around the challenges, post-pandemic challenges, and looking at how we build back better, how we restore some of the things in society that we've lost over the last few months. I think what we need is a whole societal approach. I think some of the traditional boundaries between the voluntary sector, the statutory sector, the local governments, national governments, people and communities, those boundaries don't make sense anymore. We've got to come together as a whole society. We've got to recognise that there are skills, there are opportunities to be unlocked in all different sectors. And I think that's really, really important. And it's fantastic today to be sitting, with a doctor and a pianist and conductor, and thinking about the fact that in the future, it may not be a default that somebody gets a referral to a doctor. They may get a referral through to sit down with a pianist. And isn't that a wonderful opportunity to try and think about health through a very, very different lens?
I think that's very much what we want to try and see, and have that holistic approach to break down the silos, because health is wealth, as they say. And I think health is not, it's has a wider impact, the social determinants of health. Ingolf, from your perspective, I mean, the opportunities, I mean, we're learning from yourself today, the opportunities for music to influence not only health, but shall we say education of the future. Where do you see the opportunities in the next 12 to 24 months? I mean, you talked about the music. There must be exciting opportunities looking at Africa from a musical perspective as well. The frequencies, the sound. Also, I know from a medicinal place we can speak to Dr. Miranda as well. I'm sure there's plenty of knowledge that can be shared from Africa into Western society as well. But Ingolf, from your perspective, where do you see the opportunities for the next 12 to 24 months, and how do we build back better using the arts?
Well, I see, and not only is it my wish, but I see that the market is going this direction, that we have loads of opportunity. And I don't say that to be positive. It is really positive. So due to the connectivity, simply due to the software solutions that people now had to use, the doors are wide open for people to actually reach, let's say, knowledge that they would have never reached in a direct way before. So this is very, very, very positive. And I had to, because I was showing this, because when Dr. Mwande said about the dancing and the music impact in Africa in general, I love that, because this is exactly what it is. This is the proof that we are music, that we are frequency, that if there is good music and valuable music coming, then our bodies are moving, especially kids' bodies. And this is so healthy, first of all, and it shows perfectly that how much we are one with the music, and why it is so important to be aware of quality in music and be aware what you feed your ears. But back to the opportunities. So first of all, I think due to the solutions, we really can reach more and more people to get more and more knowledge, and we can select much better what we kind of take into us or listen to, or and especially important with these solutions is and will be for the future that music just is as simple as this. Music has to get back to having a major role in all schools, in curriculums, like it was in the past. Mathematics was as important as music in Da Vinci's time. And I know we are now advanced in so many ways, and gotten worse also in so many ways at the same time. But I think we have a huge opportunity that we leverage this power of music, because I especially see that in my work when I'm with my developers and when we do software development and write code, then I see that on an everyday basis how important actually music education would be for coders. This has not, they don't have to be musicians, and we by God don't want to be, we don't want everybody to be a musician, but doesn't matter what you do, this kind of out of the box thinking, this combination of motor skills and thoughts generally, because this is why piano is so important for the brain and so good for the brain, because you constantly, if you practice a lot, you constantly connect motoric movement with an intention. So may it be a musical intention or whatever, and this is what sharpens your brain. It sharpens your reactions. It sharpens your out of the box thinking, and this is just one of many advantages of music. But I think this is the to come to the point, the main advantage is that we now take the opportunity and get everybody a proper, valuable music education. And by the way, it's not about genre. I'm not a classical musician that says classical music is the best. I gave a TED talk about that. The value is in all genres, by the way. You have bad classical music, you have great classical music, you have bad pop, you have great pop, and so on. And so we have to leverage this quality music education for everybody. Doesn't matter which kind of way of work you will have.
And I just wanted to go to James just on this point. There is so much emerging evidence coming out about, you know, these sort of solutions and the value that they create. This you know, when we talk about opportunities in terms of, you know, you talked about new job creation and that, this really does open up a massive opportunity when you think about educational systems, you know, development of research, development of new ways of working. Ingolf spoke about previously about, you know, artificial intelligence, and everyone is afraid and fearful of, you know, displacement of jobs. But perhaps this gives us an opportunity to actually create something that we want to do as a society. So as an individual, I can now focus on what my passion is, but also from a medical perspective, we can show and demonstrate, well, actually, this is good for you, you know, less stress, less likely to develop cancer. You know, so this is probably an enormous opportunity. And I mean, I'd love to hear some of the evidence base that you're developing through, you know, NASP and through the Global Social Prescribing Alliance. What are your thoughts here, James?
So I think the thing is here that, you know, the evidence base is incredibly strong. It has been for many years now, but we've not necessarily applied that in the way in which we develop solutions. So, you know, we know that exercise is really good for us. We know that if that was a drug, we should all be prescribed it. And there's not many circumstances that exercise is not beneficial to human beings. We also know that you know, the emerging evidence, as you mentioned, in terms of music is really strong as well. That Ingolf has mentioned some of the areas, but we know that you know, experiencing music can release endorphins. We know that it can reduce cortisol levels by reducing stress. You know, there's all sorts of biomedical things that happen to people when they are experiencing music. And I think where music and the arts is concerned, there's different levels that we need to look at. I mean, Ingolf touched on a few of these, but, you know, just experiencing music or the arts is good for us. Going and watching a live concert, going and watching a performance, we know that that has an impact on our mental health and well-being, and the community connection that we get is also really important from that. I think the evidence shows that being socially isolated and lonely is equivalent to smoking 25 cigarettes a day, you know, in terms of the health impact. So actually that connection through experiencing music is really important. You can then go up a level and participate. So singing in a choir, playing in an orchestra, and that's going to have a higher level of connection for somebody. That's going to create much better circumstances for them to live well. And then you can have solutions that go up another level and become specific interventions, whether that's a bit of tech that connects people effectively, whether or not that's using music as a specific therapy, or creating a playlist for somebody with dementia to trigger certain aspects of their daily life, a playlist for relaxing, a playlist for getting dressed in the morning, a playlist for activity. Those sorts of things are really, really positive things to work on. So I think that we're only just tapping into the massive potential of connecting health and well-being over here, that's existed over here for many years, with all of the things that have also existed over here that have made us well or not well, that we've not necessarily acknowledged, whether that's music or the arts or the natural environment or exercise, and being part of society, being socially connected. And what social prescribing does, it brings all of that together, and it says, let's just work in a very different way. Let's trust different people. Let's open up health and well-being to new people, to new sectors, to new audiences, and to new workforce as well, because I think we do need to train up clinicians in recognizing the benefits of social activity. We need to make sure that that's embedded in medical schools. We need to make sure that personalized care and social prescribing is there. And we're doing lots of things with the Personalised Care Institute to start doing that in medical schools over here. But we also need to look at other communities as well, and train musicians in health and well-being and supporting people, as an extra string to their bow, a virtual string to their bow, and create the opportunities for learning in those sectors as well. So I think it's a really great and exciting future for the way in which we deliver healthcare.
Absolutely, and that brings us to the Sustainable Development Goals, which is really so important to the topic of discussion today. I suppose one of the areas that I suppose all of us are working towards is, how do we finance all these projects? Because when we talk about the value created, how do we measure that? And I think we can learn a lot from the tech companies, because if you look at the market cap value of a lot of these technology companies, you say to yourself, they're worth $1 billion, they're worth trillions of dollars, whatever it may be. It's mainly down to intangible assets. So it's all about intellectual capital. It's about the numbers on the platform, the volume. And I think we need to see, how do we bridge the gap between the financial markets and healthcare? How do we demonstrate that value created so that the investment flows? I think COVID has really given us that opportunity to kind of explore that and accelerate that process. I just want to also talk about African solutions, and perhaps Dr. Miranda, you could give us a bit of an insight into, when you talk about mental health, I see there's fantastic initiatives in Zimbabwe, for example, just people getting together, congregating around an actual bench where they can actually discuss their problems. Do you see out of COVID, you talked about solutions that are evolving in Africa, and you talked about digitalization. Do you see in the next, shall we say, couple of years, Africa taking that leap? Because it's very much seen as an emerging, developing continent, that it needs so much support in terms of its health infrastructure. Do you think Africa can actually come out of this and take the bull by the horns and say, we want to promote good health and well-being? We want to empower our local communities to improve their health and well-being, and focus on a preventative approach, which could absolutely accelerate their development as a continent, in terms of productivity, in terms of efficiencies, keeping people fit and well. That's a massive opportunity. So what's your thoughts on that, Dr. Miranda?
Yeah, thank you, guys. I think that is a big opportunity, because it doesn't cost much. All you need is just need a champion. Just need a few people who want to take that extra mile. Because one thing we should understand is, getting ill is very, very expensive in Africa. It's very, very expensive. So, but again, staying healthy is fairly cheap. You just have to look after yourself, and that will improve your income. It's going to make you happier, and the community is happy. Everyone's healthy. So I think for Africa, I think in the issue of well-being should be at the top of the government agendas for development. It be part of the main strategy because it does not need too much money in it. I think it's already there. Someone just have to just turn it on, and there it is. And that would save most countries or the whole continent a lot of money. And Africa should believe on the solution that they come up with. Of course, you can learn from other people. Then you adjust those learning points from other people to fit in what, not copying what someone is doing, but to adjust what you're doing to take yourself at a higher level, a better position. So I think when it comes to mental health, and because it's got a bit of a stigma in most of African culture, mental health got a big stigma. So it's not something that we talk openly about. So I think if people can feel comfortable on the stuff, like I said, we need a champion who can get out there and just make this normal. If you're talking about music, why can you talk about mental health? No, you talk about diabetes. Why can you not talk about mental health? So we just have to take that part of the normal conversation, and then people can understand, because sometimes people have issues, but they just they don't know how to approach it, or they don't know they have issues. It takes someone else to say, okay, Nas, something like this is happening. Okay, talking to someone, and that's what it all takes. And in Africa, we have more a community, because I grew up in a village where everyone knew everyone. If I was naughty, and my mom would know that I can be disciplined by the neighbor or something like that. So we can do those things, look after one another, and that is a part of the culture anyway. And I think we just whether. I know globalization in a way is a good thing, but I think we should not drop out the things that have kept us going, and I think we can build them better to save us for the future. I think this is the cheap way of you don't have to be rich, but you just have to be happy and healthy, and that's the way I say it.
I couldn't agree more, I think, but I was going to say as well, I mean, there's a huge opportunity really for the diaspora. You're an expat, shall we say, from Tanzania. You left Tanzania, you've left the continent of Africa, you set up shop in the UK, but there's certainly an opportunity here, isn't there, for your colleagues around the world to come together to help Africa, to share that wisdom, to go back to the roots, but also, as you say there, it's really just a common sense approach, and looking after your health and well-being. It's not difficult. You can be very cost effective. As my mother used to say to me every day, have an apple a day, keeps the doctor away. Just simple things like that, how you eat, and, how you exercise, and just getting 30 minutes of exercise in every day. I mean, these can have profound effects. And, where is the role? What do you see the role of the diaspora of Africa? Because you've got so many people around the world who affiliate with the continent of Africa, and I think there is a misconception there that people believe that Africa it doesn't have any wealth, but Africa has a lot of wealth, and it has a lot of knowledge, it has a lot of wisdom, and it has a very young population. That's a resource that can be tapped into. So do you think the diaspora around the world has a role to play to help recover from COVID-19, to help propel Africa forward?
Yeah, definitely. The diaspora have a big part to play in this. I think the main thing is for the policymakers and the government to take the opportunity, because sometimes some of the diaspora feel like because they left their country, they just they'll be seen as if they just abandon their country and just to go somewhere else. So there, in some places, there's a bit of bad blood, if you like. And I think if governments see the diaspora as an allies in pushing the country forward, I think because there's so many experts, just the little group. We have all sorts of experts. We have the engineers, the doctors, the nurses, physios, and they become mental health experts. So, and they have different sort of training and different sort of exposure. So if they also feel a bit more engaged by the relevant government, I think they can play a major role in making progress in the continent, especially when it comes to recovery after COVID. I think we're still working on that. For example, in Tanzania, the diaspora have working hard to engage the government around the issue of COVID, and I think things are changing, and I think the diaspora have put a bit of more push to see for the government to see what we see, because it's not we are all connected in a way. So it's not just okay, Africa is on Europe and America on their own. We are all one. So Africa depends on other countries, and other countries depend on Africa as well. So this has to be that mutual benefit to be realized. So the diaspora can take it's being seen as part of the solution, and that, to me, I see that we are part of the solution. So the government has to engage. I mean, for example, for Together, we're engaging with the government. We work closely with our High Commissioner here and our diaspora desk in Tanzania, and similarly, our colleagues in America, they're doing the same. And I think hopefully in a year or two, things can be different. We can all just go back there, maybe not permanent, just to go to help to see, sit at the table, discuss, see what we can do better to lift our people. And that's what I see the position of the diaspora is very, very crucial in this.
Yeah, thanks. I totally agree. I think I was going to go to Ingolf and just ask Ingolf, the music industry, as James and Dr. Miranda has said, we're all connected. The music industry has suffered just as the health services has suffered. What do you think are the lessons here and the learning going forward, that we need this joined up approach, that we need a bit more collaboration, we need to see things through different lenses? James mentioned, having a look from your perspective, from a pianist perspective, looking on the outside, what do you see as lessons here? Like, for future, we need to avoid future pandemics. This certainly will not be the last one. And we need to ensure that this doesn't happen again. I'd love just a little bit of insight from yourself. What do you think? What are the lessons here?
Oh, that's a big question. I mean, there's definitely, let's start from the music business perspective. There's definitely lots of things that didn't go right before the pandemic, and I personally, I'm thinking about that. There's too much of everything. This is a general in our world. We are bombarded by too much information, too much of everything, and people can't, because the brain just shuts down if you get too much input. You just either you try to take as much as possible and shallowly, or you focus on just a couple to really take on. So I think there was in the music business too much of everything going on before. So I see absolutely I'm always positive. I see a big opportunity that we can now build back like that we have less of things but better. I think this is what we need to focus on. I don't know if humans will learn. They seldomly do, but I definitely think that there's a huge opportunity here. Yes, and I think it's not only in the music business. Generally, we have to. I know there are lots of movements like humane technology and stuff like that, which are like very much because we will have to. I think in the post-pandemic world or in the, let's say, next 10 years, we have to ask the value question for many things. We have to ask why we're doing things in the first place, and then answer this and then make changes accordingly in almost every field. So I think I see it as an opportunity, like a cleansing, if you will, like that we get rid of the things that we didn't need and maybe because of money issues that we have to take care of expenses and so on, things will just become rarer, which is a good thing. And maybe people will appreciate things more. And I think it's a healthier approach.
No, I agree. And we're coming to the end of the session. We've got about 10 minutes left. So I just want to go to each one of the panelists as well. And we do a final wrap up, but then I wanted to just have a quick chat with James about learnings, lessons and opportunities. And, in healthcare, we always talk about best practice, sharing best practice and learning from our mistakes. And I think one of the things we have to do as a society as well, if we look at our parliaments as well, they were set up in the 1900s, and we're now in the 21st century, and we need to adopt and change very rapidly in this digital age. Do you think there's a profound opportunity in the healthcare sector to actually accelerate that learning process? From the point of view, James, we talked about the evidence. I know I've worked in many clinical settings for many years where we know that a certain situation works, but however, we need more evidence, and we need to almost continuously provide that evidence to show that it's valuable. Do you think there's an opportunity here to accelerate that process? You look at the vaccine rollout, for example, which really showed what 12 months of focused effort, like Ingolf has just spoken about there. We literally turned around to the best minds of the world and said, get a solution for that as quickly as possible and do whatever it takes. And we managed to do that within 12 months, which is just phenomenal. So we condense processes down to having an effective vaccine. Do you see that what Ingolf has touched on as a future for healthcare?
I think there's so much possibility here. I mean, as you say, the response around the world and the response of science in creating a vaccine has just been breathtaking in terms of the speed at which people have moved. If you also look at what's happened in England with 750,000 people signing up to be NHS volunteer responders to support people in their own communities, and how communities have come together much stronger than they've perhaps done before to support neighbours, to support people that have been more clinically and socially vulnerable to COVID-19. I think that's been huge, and we need to continue that rate of change, don't we? We need to continue that pace. We also need to continue that level of connection as well. I think one of the challenges, just in your question there around what we need to do, I think what we need to do is we need to accept that good practice and solutions could be happening somewhere else, and we just need to adopt them. One of the biggest challenges, I think, in healthcare and possibly in other industries is the not invented here syndrome. And actually, I think we've got to embrace the fact that many of the solutions are already out there. They could be in a community organization, they could be in a different country, they could be in a different industry. And actually, we've got to just be more accepting of those solutions coming from a different source rather than trying to start from scratch and reinvent the wheel. And I think that's a big challenge. We don't have the time to do it. We don't have the luxury of that time. We've got communities that are struggling. We've got individuals that are struggling, and we've all got a responsibility to help and support. So if there is a fantastic solution in Africa, we need to adopt it over here. If there is a fantastic solution in the music industry, we need to get that embedded. And I think we've just got to look across global boundaries and borders, and look across industry boundaries and borders, and get on with it. I think that's it.
I think this is a really fascinating point, and you touched on it earlier. You talked about social enterprises, you talked about the voluntary sector, and I think we have to also start to recognize that these are businesses, And one of the things I met a student at lunchtime today. We were having a conversation about the future and about opportunities, and we look at all these companies around the world, those that are making enormous amounts of money, and then we never seem to see a social enterprise at a scale, like why can't we have social businesses that do good in their communities, that generate large sums of cash flow that can be reinvested back into the community, and then the community knows that that money is coming back into society, so that that's helping their local communities. I think we can see that shift coming. COVID hopefully can accelerate that process. because ultimately it comes down to knowledge and wisdom and shared values. And I think, you know, we as a global community can foster that as you know, because what do we want for our children? What sort of society do we want? So I think those solutions are out there. I think if you go around the world as well, and if you go into each local community, you'll almost identify with local solutions that can have global impact, you know, so people doing stuff locally, really good stuff that can have a wider impact. And I'm sure Africa can really accelerate that process in the future. Let me just wrap up by, you know, just coming to each one of you just for some final words of wisdom to those watching. I'll start with Dr. Miranda. You know, just summarize the session, share your final thoughts on your thoughts for the future, for sustainable development goals, for COVID-19 and for Africa.
Okay, thank you, Gareth. My final point would be, I think we need to be adaptability and learning on the go and fast, as we have done during COVID, and so we have proved that it can be done. So we just have to be able to learn on the go and adapt pretty quickly. And but the main thing as well I would like to see is having honest, decisive, and effective leadership of our nations. I think that has been a very, very important point in this pandemic. So having a good leadership that listen to the people, not to what they have in their own boardrooms, but what do listen to the people, because everyone's voice matters. And I think you know, that person you ignore, the farmer in the village, maybe the one who have the solution, just he or she might say one thing, it's okay, oh, it just it gives you that light bulb moment. So it's important to have a listening and effective and honest leadership, because the choices we make today will define our tomorrow.
Absolutely. Thanks for that, Naz. And Ingolf, just from your perspective, final words, thoughts on the session that we've just had, some of the wisdom that's been shared. What do you see for the future? Sustainable development goals, 2030 agenda, will we reach our targets?
Well, I would wish. I mean, because as the SDGs, if done right, and I know they are for sure, as everything in with humans, they are also misused often. But if done right, they're a great thing, and we need to stick to it and try to still reach the goals, even if tough. I liked so much the inputs. You know, it's like the local solutions that we need where we can use or let's say make worldwide impact by using local solutions is a great thing. Working together, which is of course part of the SDGs. This is all excellent. We have to in the future, I think, ask the question why more often. Don't let the market decide what we need, or let only the market decide what we need. Let the experts decide, and then maybe let the market decide how we do it, but not what we actually need. And bring education to everyone, or to as many people as possible. This is what our mission is and what we are working on every day. And use valuable music to make our lives better and people healthier.
Thanks, Ingolf. I mean, this is it's quite profound actually that we can talk about such opportunities in this time of, shall we say, crisis. And I think we're led to believe we are in a crisis situation when actually there is huge and enormous opportunities out there. And I think it is important for people to be open-minded and to embrace these opportunities that come our way. James, final words from yourself in terms of, you know, the future of social prescribing, the role it can play in implementing the 17 SDGs, and any final words of wisdom for those who's joined this session today.
Thank you, Gareth. I think, you know, COVID-19 has exposed the vulnerabilities of healthcare systems across the world, and the vulnerabilities of individuals and communities as well in terms of their own health and well-being. But it's also demonstrated the might of healthcare systems and professionals and communities at the same time, and been astonishing at how those communities have responded. I think for me, the most important thing going forward is what Dr. Mwande was saying in relation to leadership and partnerships. I think we've got to have an openness to learn, and we've got to have an openness to learn from areas and sectors that we perhaps haven't been open to listen to in the past. And I think we've got to have a willingness to work together in a very, very different and innovative way. And that's why we formed the Global Social Prescribing Alliance. That's why Gareth and I are passionate about that opportunity to bring countries and individuals together across sectors to have this conversation around how we can achieve those sustainable development goals and how we can work together in new partnerships. And I think that could be a really positive thing to come out of what has been such a challenging 15, 16 months for the whole world, and really passionate about making that happen.
Yeah, totally agree. And also, it's, if you just come back to the why, you know, everything has to start with why. And I think everyone on this panel here, Ingolf, Dr. Mwande, James, you know, we're passionate about making a difference. We're involved in the SDGs because we want to make a difference and we want to help people. And that's why, you know, I was drawn into the health sector. It's because you want to help and make a difference. You want to help your, you know, people who are in need, the most vulnerable in our society. It's a measure of any, you know, shall we say, modern economy. It's how well you look after the most vulnerable in our society. So these are the challenges we face, but there are big opportunities ahead. And I just want to thank the World Health Summit for inviting us to host this session. I hope it's been informative. If you have any questions, you can contact us online. You can contact James at the National Academy of Social Prescribing.com. Tueda is available.com, and Ingolf Erdner you can find across social media platforms, and ourselves at WIS.uk. We'll close this session. I hope you've enjoyed it. And from myself and the panel, we just want to thank everyone for tuning in. We're extremely grateful for the time. I'm extremely grateful to James, Dr. Miranda, and Ingolf for giving their precious time up to share these words of wisdom with everyone today. And then we'll close this session, Moses. So thanks very much, everyone. And it's been a fantastic opportunity to share these thoughts with you today. Bye.
Pleasure.
Thank you very much.
Thank you.